the intraosseous injection. This is a supplemental injection with a rapid onset, and it is used when conventional injection gives inadequate pulpal anesthesia for teeth with vital pulps. This injection usually produces tachycardia, so the patient should be forewarned. There are commercially available devices from Stabident. The perforator and a matching ultra-short needle are shown here. If the premolar is to be anesthetized, the perforator is positioned at approximately a 45-degree angle to the bone. After penetration, the perforator tip drops into the medullary space. Note that on the mandible, the cortical bone is dense and it increases in thickness to the posterior. This is why the posterior mandible is difficult to penetrate with the perforator. This shows the location of penetration, which is in the interradicular space with the attached gingiva slightly apical to the cervical margins of the crowns. The perforator, or number 2 round burr, is positioned and advanced slowly. Use alternating pressure or a type of pecking action. If the perforator is not advancing, it has become dull and must be replaced. If it is not replaced, the perforator may bind and break or create frictional heat and burn the bone. The perforator has been replaced, and this alternate pressure is continued until the perforator drops through the cortical plate and into the medullary bone. The needle must be positioned exactly in the same spot and in the same orientation as the perforator. Otherwise, it will not penetrate and be in proper position. Some maneuvering is often required. Place the needle to its hub against the tissues to minimize leakage of anesthetic into the oral cavity. Approximately a half cartridge is injected under some back pressure. Note the blanching of the mucosa. The X-tip is a combined perforator and a sleeve through which the needle is placed. This is generally effective and simplifies needle positioning. One problem is that there is a greater likelihood for the anesthetic leakage around the opening and into the oral cavity.